Good afternoon, everyone. I'm Nancy Wodrago with the University of Illinois Extension, and happy to have our co-host on Rural Partners and be able to kick off this Governor's Rural Affairs Council Health webinar series. I am very grateful that Laura has been working so diligently on these topics with the Rural Affairs Council and Rural Partners. And want to hand it over to her to introduce this series and the topic and thank everyone for coming. I really appreciate it. Laura, thanks for being here, and I'll hand it over to you.
Thanks, Nancy. Rural Partners appreciates the partnership with University of Illinois Extension as well. Again, as Nancy said, Laura Hepkessel, I am the Executive Director of Telehealth at the SIU School of Medicine. But today I am wearing my Rural Partners board member hat and want to thank everyone for joining us. Rural Partners is the state's Rural Development Council. We're a not-for-profit organization. We're membership driven. We have a volunteer board. We really try to connect people with resources. And one of the things that we try to do to offer information and resources to our rural communities is offer this webinar series in partnership with the University of Illinois Extension. This webinar series is also in partnership with the Governor's Rural Affairs Council. I have the privilege of chairing the Health and Healthcare Committee as part of the Governor's Rural Affairs Council and serving alongside Liz Vogt, who is our speaker today. So Liz is the Chief of Staff with the Illinois Department on Aging, and she's going to talk to us today about Aging Network Services. This is the first webinar in a series of 3 that we have scheduled over the next month or so. The next webinar is scheduled for Thursday, August 29th, where we're going to hear from one of our colleagues at the Department of Human Services about their family community services programs. And then the following webinar will be on Thursday, September 5th, where we will hear from one of Liz's colleagues who's going to talk to us about the state plan on aging, and it's going to be a little bit more of an interactive session. So just know if you have an interest in any of those topics or want to continue through this series, we do have 2 more scheduled over the next few weeks. Liz, we're going to pass it over to you, and we appreciate you being here. And if you have, if you have questions, please enter those in the chat. If Liz sees something, she may go ahead and address it as she goes along, but otherwise I'll moderate those questions at the end with Liz. So just put questions in the chat. Thanks so much.
Great. Thank you so much, Nancy and Laura. Appreciate the warm welcome, and thanks to all of you for joining me over your lunch hour. My name is Liz Vogt. I'm the Chief of Staff at the Illinois Department on Aging. And we are a state government agency that is tasked with serving and advocating for our older Illinoisans and their caregivers by administering culturally and quality programs that promote partnerships and encourage independence, dignity, and quality of life. And I think what's so unique about our Illinois Department on Aging is that partnership piece. So it's not just the Illinois Department on Aging, but we have an entire aging network of providers and different entities that really meet the needs of our older Illinoisans and their caregivers in their communities located across the state. I was just looking through the chat here and I see representation from Decatur. I was born and grew up in Decatur, so a shout out, and Piatt County, and my parents live in Cisco, Illinois, and I live in Menard County now, and just north of Sangamon County in central Illinois. So love to see all of the good representation here on the line today, and thank you so much for joining us. We're going to dive right in. One of the best ways, if you have questions that come up, if you're interested in learning more about the Illinois Department on Aging or the Aging Network Services, we have a team on our senior helpline available Monday through Friday, 8:30 to 5, day in and day out. And this is really an information and referral hotline. They're available to answer questions, to make referrals to different entities within local areas across the state, provide information on our programs. And so when we think about, what's the best front door, right, to accessing aging network programs, oftentimes it may be our senior helpline, and they can kind of act as a quarterback and direct you to exactly where you need to go. So I'll definitely be sharing the slides after the presentation, and just keep that 1-800 number handy. It's very useful to share with your local community. Another easy way to find services and kind of access information 24 hours a day, 7 days a week is through our provider profile on our ilaging.gov website. Right, you get to this access page, you can click here and put in your zip code, what type of services you're looking for, and it pulls up all of the local service providers in your area. So this is just another way, if you want to do a little more digging, or you're up in the middle of the night looking for resources and the senior helpline isn't an option at that point in the day, you can always hop on our website and find a myriad of helpful resources and information on how to connect with your local service providers. So I just wanted right off the bat to provide those two entry points and ways to really access and identify services at any point. So today we're going to talk a little bit about all of our different programs and services. And, these are the main ones we're going to cover today. I could spend all afternoon with you talking about every single program and service that we offer and still not get through them all. But, realizing we only have a short amount of time here over the lunch hour, we're going to hit on the main ones. And these are really through our area agencies on aging, or AAAs, as we call them for short. There are 13 located across the state. Our community care program. You may be familiar with this program. It is a Medicaid waiver program that serves older adults 60 and over, and provides services and support to help keep them safe and healthy in their homes and communities. Adult protective services. So if there's concern about potential abuse or neglect or exploitation of older adults, our adult protective services program is at the ready to intervene and assist in those cases. Our long-term care ombudsman and our home care ombudsman programs we'll cover today. Benefit access program, as well as our SHIP, or senior health insurance program. So we're going to start with our AAAs, or area agencies on aging. And as I mentioned, there are 13 throughout the state of Illinois. We break up the state into 13 regions or planning and service areas. And there's one AAA responsible for each of those regions throughout the state. What's interesting is that, sometimes they can be a unit of local government. So in PSA 12, which is the city of Chicago is actually the AAA for that area. But throughout the rest of the state, we have community service organizations, nonprofits, who operate as AAAs in their respective area of the state. And their primary task is really to plan and coordinate the services and programs for the older adults and their caregivers in their respective geographic area. So they do an area plan every 3 years where they look at, okay, what are the demographics? Have we had any population shifts? And really connect with those at the local level to understand what are the needs, have the needs changed over time, and how do we best build in services and supports to address those needs. They serve all older adults. So services through the AAAs are not means tested. You don't have to be at a certain income level or an asset level to access programs through our AAAs. But they do primarily focus on older adults who have what is defined as a greatest social need or a greatest economic need. And that's a pretty complex formula that we don't need to get into today, but it evaluates things like, poverty and social isolation and all of the factors that really impact our older adults and their ability to age well. So they do provide services to older adults age 60 and over, as well as their informal caregivers, family caregivers. And they're typically not the direct service providers in the area. They contract with local organizations to provide the services and programs in that specific area. So what kind of programs and services do the AAAs fund? Nutrition is a huge one. So you may be familiar with home delivered meals, Meals on Wheels, Daily Bread. It's called something a little bit different depending on where you live in the state. But this is really where volunteers go out into the community. They bring a hot meal to an older adult in need and check on that older adult to make sure that they're doing okay. They also offer congregate dining in certain areas. So congregate dining refers to, a group setting at a location where a meal is provided, different socialized opportunities for socializing and activities, and also nutrition counseling. So ensuring that if there are special dietary needs or, just general information on how to really, feed your body with nutritious foods. Another service area provided through our AAAs is respite. And so this is really a service provided more towards our caregivers. So, a caregiver, I'm maybe caring for my aging mother. I have to run to a doctor's appointment or maybe an outpatient surgery. Respite is a service that ensures that a caregiver is there caring for my mother when I'm not able to on a short-term basis. Transportation, we know, especially in our rural areas, transportation is such a major issue. And so through our AAAs, there are opportunities to provide transportation in some instances to our older adults. Also, senior centers are funded through our AAA network in many instances. Again, it's a location where older adults come together in the community for activities and socializing, different even exercise programming, and really have that opportunity for community and activity. Evidence-based health promotion programs. So these are things like stress busters, savvy caregivers going along with the caregiving supports. There are programs that are really offered to help older adults and their caregivers navigate the stress and, sometimes just strain that comes along with aging, with, caring for a loved one who is aging, to ensure that the caregiver has the supports that they need to stay well. And then lastly, legal assistance. So things like, drafting a will or power of attorney, all of these things that are so critical as we age and think about things that may pop up in life, that it would just be a lot easier if we had these key documents and legal documents in place to help us through that. So here's our map. As I mentioned, we break out our state into 13 different areas. This is how it breaks out. And there, as I mentioned, is a AAA, an area agency on aging that covers each of these 13 regions of the state. And the link is on your screen for the contact information there for the AAA for your region. So next, we're going to move to our community care program. This is another extremely large program that we administer at the Department on Aging. It's about a $1.6 billion program. It is the largest Medicaid waiver program in the state of Illinois. We have over 100,000 older adult participants in the program. And it's really a home and community-based, or HCBS, as the federal government likes to call it, program that helps our older adults age 60 and over age in place and avoid nursing facility placement. So much of the work that we do at the Department on Aging is really intended to support our older adults to age in place. And what does that mean? It means to stay in their homes, to be active in their communities, and really, avoid unnecessary or premature institutionalization, moving into that nursing home when, maybe just a few supports in the home environment could keep the older adults safe there for many years to come. So to be eligible for this program, it is a means-tested program, meaning that you have to have $17,500 or less in non-exempt assets. So non-exempt assets are separate and apart from your sort of basic assets, like your home, an automobile, that sort of type of asset. So in that regard, it is a means-tested program on the asset side. There is no income limit or income level associated with the community care program. So in that regard, it's means tested just in terms of assets. Again, you have to be 60 or over to be eligible. You have to be a resident of the state of Illinois. You have to be a U.S. citizen or meet an eligible immigration status, which typically is like an asylee, a refugee, or a legal permanent resident for 5 years or more. And you have to agree to apply for, and if you're eligible, enroll in the Medicaid program as a condition of eligibility for the community care program. The last eligibility criteria is a minimum DOM score of 29 points. And so, not to get too much in the weeds here, but an assessment is performed to understand what are your functional needs. Do you need help walking? Do you need help bathing? Do you need help preparing meals? And so the assessment really measures all of those areas and determines if you meet a threshold where you would require assistance from this program. So what services are available under the community care program? It's important to note that these are all non-medical services. What do we mean by non-medical? So things like nursing care would not be included, wound care not included, different kinds of therapies like physical therapy, occupational therapy, speech therapy, those are all not included. Those are considered medical services. When we talk about non-medical services, we're really thinking about things that are activities of daily living. So, ambulating, right? So getting from your bedroom to the living room to the kitchen, using a walker and those types of things, getting dressed, feeding, preparing meals, doing light laundry and a little light housework, bathing, getting yourself ready for the day, assistance getting to a doctor's appointment or doing the grocery shopping, those types of things that are non-medical in nature, but are just so vital to your everyday life. Those are the types of services that our community care program is intended to address. So comprehensive care coordination. We have what are called care coordination units throughout the state. And those are the entities that perform that determination of need assessment that we talked about on the previous slide. So they assess our older adults to understand what their needs are, and they determine their eligibility for the program. They also coordinate the services that the older adult needs and can connect them with other needed services through other programs. Another service area is our in-home service. So this is where a home care aide would come into the older adult's home and help with those things like, preparing meals, helping them get dressed every day, bathing, grooming, the laundry, the housework, those types of things are covered under in-home service. Adult day service. So this is where an older adult can go. It's a location within the community where they attend. It's, a full day, usually from, morning to late afternoon. Meals are provided there. And it's really an opportunity if a family member is the primary caregiver, but they have to work during the day. Adult day service is a great option. So they know their older adult is safe and is being cared for while they're at work. Emergency home response service. So think about this as like your lanyard, your push button, or your watch that you push if there's an emergency, maybe you've fallen, or you have some other issue that you need immediate emergency response. That is covered under this program. And we've just recently expanded to allow for fall detection capabilities. So, if you fall and, heaven forbid, you're sort of knocked out, that device can detect that you've fallen and it automatically call the emergency line, even if you're incapacitated and unable to physically push your button. We also have GPS equipped devices. So this is especially important for our older adults who suffer maybe from dementia and they tend to wander from their homes. The GPS can, just automatically connect with that emergency response center and give a precise location of where that older adult is. And then lastly, the automatic medication dispenser service. So this is a device that dispenses medications at a certain cadence based on when you need to take those medications and the correct dosage. So it's really helpful for those who, maybe forget to take medications or are doing so kind of irregularly, and they really need help sticking to their prescribed schedule. And all of these services under the community care program are really accessed through those care coordination units that I talked about. And the link on the screen here would take you to our search where you can find the local care coordination unit in your area. And that's sort of the front door to this program. Shifting gears now, we're going to talk about our Adult Protective Services program. So this program addresses, we have caseworkers working throughout the state at 36 provider agencies, and they respond to complaints of abuse, neglect, exploitation, and self-neglect for older adults age 60 and older and adults 18 to 59 with disabilities who are living in the community. They investigate the allegations and then they coordinate with that older adult or the adult with disabilities and really create a plan for services and supports that can help that older adult and mitigate the risk of any abuse, neglect, exploitation, or self-neglect to ensure their health, safety, and welfare. So how do you make a report if you're concerned about an older adult in your life or an adult with disabilities living in the community? We have a hotline number that you can call 24 hours a day to report that suspected abuse, neglect, exploitation, or self-neglect. And then that activates one of our APS caseworkers to go out and talk with that older adult and investigate the situation. Our ombudsman programs. So this is a term that a lot of people just really are not familiar with. But an ombudsman, I like to think of them as an advocate. So we have two ombudsman programs, one a long-term care ombudsman program, and the other is a home care ombudsman program. The long-term care ombudsman serves and advocates for individuals who live in a nursing facility or a long-term care facility. They are trained, they regularly visit nursing homes, and they monitor the conditions and the care, and they really provide a voice and advocate for individuals who may not be able to speak for themselves. They are typically contacted maybe by the resident themselves or by a family member of the resident and says, hey, I've got some concerns about my mom or my husband who's in this nursing facility, and I don't have a good feeling. Some things just don't feel right. Maybe they're not getting the services that they should be getting on a regular basis, or the ombudsman can meet with that resident, understand what are the concerns of the resident, and then help that resident advocate for themselves to really resolve whatever the situation may be. So there's the telephone number on the screen or the email address where, you can always reach out and contact an ombudsman with any concerns. and they can help advocate for that resident living in a long-term care facility. I'll say just kind of a distinction to note here. So it's separate and apart from the Illinois Department of Public Health. So public health actually regulates the nursing homes. And the Ombudsman program, they're not regulators, they're advocates for the resident. So, if there are significant concerns about the nursing facility and things that are going on there that maybe just in general or, really just egregious issues, those should be routed to the Illinois Department of Public Health as the regulatory body. But the Ombudsman program, they are there to really advocate for the resident and to ensure that they're getting the supports and services that they need. Our home care ombudsman program does something very similar, but just with a different population. So our home care ombudsman program, they advocate for individuals who are enrolled in the Medicare Medicaid Alignment Initiative, or MMAI for short. So this is a type of health coverage for individuals who are duly eligible for both Medicare and Medicaid. So they're older adults, they're low income, and they are enrolled in one of the MMAI coverage programs in the state. They also advocate for individuals who are enrolled in a Medicaid waiver program. So the community care program we talked about earlier. There are also 3 other waiver programs that they help advocate for as well. But the key component here is that the individual lives in the community and is enrolled in one of these programs. If those criteria are met, the home care ombudsman can help advocate for that individual to really ensure that they're getting the services and supports that they need as well. And the telephone number and email address are on the screen there for contact purposes. Okay, our benefit access program. This is a program that allows certain older adults and persons with disabilities to secure license plates at a discounted rate or free rides on fixed route transit systems. We at the Department on Aging, we administer the enrollment in the program. We have individuals who are interested apply online through the link you see on your screen. And if eligible, you do get license plate discounts, you get free rides on those fixed route transit systems. It's important to note that there are different requirements or eligibility criteria for the program. So it is means tested, meaning you have to have at or below a certain income level. You have to be a certain age. You have to live in Illinois. But if all of those criteria are met, your application is approved. You're then allowed those discounts on license plates or free rides on fixed route transit systems. This is a hugely popular program. Our benefit access team processes tens of thousands of applications a year. And, this program is one of the most visited ones on our website. So if you're not familiar with it, it is a good resource for our older adults. And then lastly, I wanted to cover our SHIP program, or Senior Health Insurance Program. So, I know my parents recently enrolled in the Medicare program, and, there's a lot of new information that you have to digest. And, do I pick a Medicare Advantage plan, or do I stick with traditional Medicare? And how do all of my long-term care insurances fit together with my Medicare plan? And what about, all of the other coverage I might have, or the Medicare supplements? What about Part D? What's covered under Part A or Part B? All of these questions. Health insurance, health coverage can be extremely confusing, and it is very difficult to navigate. But our SHIP program, we have SHIP counselors who are trained and located across the state, And they're really intended to be an independent, you know, completely free service to really help educate and advise you on a one-on-one basis. You know, what coverage you need, what coverage would make sense for you, how everything fits together. It's just really a phenomenal program. Our SHIP counselors are, as I mentioned, independent. They're not tied to any specific plan or, you know, the Medicare Advantage world or anything like that. They're really independent sources of really good quality, up-to-date information. So the information there, you can request more information through our senior helpline or through the email address on the screen there. Really just such a good program and helps folks navigate the always changing world of Medicare. And then I just wanted to mention planning for the future. So we know that our older adult population is growing significantly. And, you know, our older adults are living much longer, but with a lot of complex health issues that we have to navigate. And so as we think about, you know, the world of aging and how do we really modernize our programs and services, we have a few opportunities to do so. We are required through the Federal Administration for Community Living, or ACL, to develop a state plan on aging every 3 years. And that's where we take the area plans that our area agencies on aging have developed, and we you know, do our own data analysis and really put together a comprehensive plan for aging services in the state. Our next state plan, we're just kicking off the planning process. It will be due in effect next October 1st of 2025. And we'll be hosting many different listening sessions and roundtables across the state. As Laura mentioned earlier, on September 5th, one of my colleagues, Sandy Pastor, will be presenting to this group on the state plan, and hoping to gather some really good feedback from all of you about what's going on in your communities and what the needs are. But we'll also have in-person listening sessions and roundtables throughout the state. So you can see here on your screen, we'll have one in Mount Vernon, Quincy, Springfield, Peoria, and Dixon. There are others that will be scheduled. We just don't have dates and locations quite yet, but later this fall. And Sandy will follow up in a couple of weeks during her presentation with a full list. But wanted to share this with you so you can put it on your calendar, you know, and participate, or have one of your colleagues participate as well. And then the other area, just this week, we were so excited. Governor Pritzker signed an executive order to establish a multi-sector plan for aging. So think about our state plan for aging, but sort of on steroids, right? And a multi-sector plan for aging, it's just like what it sounds. We don't consider just our aging network services, but we consider things like housing, transportation, medical services, everything that, you know, our infrastructure, everything that really plays into the ability for an adult and an older adult to age well. So we will just be kicking off our planning process. We have to have a robust plan back to the governor and the General Assembly by December 31st of next year. So we'll be working very diligently on developing this plan. There'll be an advisory council. So if you're interested in participating on that, please let me know. We'd love to have great representation from around the state to really make the plan very robust and address the needs of all of our older adults. And then lastly, just a few other ways that you can get involved in your communities with the Department on Aging, with our aging network. I would recommend, if you don't know who your local area agency on aging is, look them up. Use our provider lookup tool, look them up and reach out. They are an incredible resource and can help you, you know, really understand what are those local services that are available in your communities, in your counties throughout the state. But we also have a number of advisory councils that we're always looking for participants. So if you're interested in participating in an advisory council, we'd love to have you. And they're all listed on our website here. The link is at the bottom of this screen. And then lastly, again, just reinforcing our senior helpline number, jot it down, put it on your fridge, put it on your desk, have that handy. There's always someone I come across everywhere that's like, oh, well, I was wondering, is there a program about this? Well, yeah, let us help you. So, you know, the joke has been the aging network services are the best kept secret, but we don't want them to be a secret. We really want to make them more visible, more accessible, and really hope that you can help us get out the word in your local communities about all the great programs and services that our aging network offers. I'll put my email address in the chat so you all have that. If there are questions that come up specific to this presentation or you want to touch base, please do so. Otherwise, really appreciate your time today. And I know my colleague Sandy Pastor is coming in a couple weeks to talk more specifically about our state plan on aging and would love to have you participate there as well. So thank you.
Thank you so much, Liz. That was a great presentation. You really covered a lot of ground there and a lot of the great programs that your agency is doing and offering. Our first question, what services, programs, and support, including but not limited to financial assistance, do you provide to the publicly owned county nursing centers or homes in Illinois, aside from the ombudsman? Aging in place will only take people so far.
That's a great point, Jim. Yes, I would say that the focus of our department at the Department on Aging, we really do focus more on the home and community-based service side. Apart from the Ombudsman program, we have our care coordinators who do choices for care screenings for individuals who are entering nursing homes to determine their eligibility. But our involvement with the nursing homes are a little bit more limited. But yes, I completely understand. We actually have a county-owned nursing home in Menard County, Sunny Acres. So I can understand the challenges there as well.
There's a couple of questions about slides. I believe that Nancy will be providing those when she sends the follow-up email to everyone that's registered for the webinar series. So Nancy, you can correct me if I'm wrong there, but I think that will be the case. There are other questions for Liz. She did such a good job of covering all of the services. Let's see, the asset limit for CCP is $17,500. Is that correct?
That is correct. Yes, it just increased last year to match the Medicaid asset limit. It was $2,000 for an individual and $4,000 for a couple. It's now $17,500 for an individual to match the Medicaid asset limit. So I think it's also, though, important, there's a caveat there, 17.5 in non-exempt assets. So things like your home, your primary residence, your home, a car, those are not included in that 17.5 threshold.
Great. Liz, someone asked for your contact information. I don't know if you want to provide your personal contact information or if you want to, if there's general email addresses you want to share, but I'll leave that up to you as to what you think makes sense there.
Yep, I put my email address in the chat here. Please feel free to reach out. And if I can't answer it, I'll route you to one of our team members here that can.
Liz has great experience at the Department on Aging. She was policy director and she's moved into the chief of staff role, and she's just a really great resource for all of these programs and working with our communities. Are there any other questions?
Also, just want to mention that we have made it possible for you to unmute your microphones. If you wish to ask a question directly, you can unmute yourself and ask that way as well.
Thanks, Nancy. Sounds like a lot of people have found the information really helpful, Liz.
Great.
Yeah.
Thank you. Appreciate that.
I think you covered it so well, there aren't questions. It sounds like it's been super useful to folks and they're appreciative. But I think you covered all the bases, so we might be able to wrap up early. Here we go. Do you work with Illinois Assistive Technology Program?
We do. Great question, Carol. They are just such a wonderful resource too. I would encourage you all. They have a demonstration center in Springfield. They are the most helpful people on the planet. We do work with the Illinois Assistive Technology Program, or IATP for short. We love our acronyms in state government. But we have a program that we partner with them on that's called Illinois Care Connections. And it's really aimed at combating social isolation and loneliness, and keeping our older adults feeling comfortable to socially engage in their communities. So they provide things like tablets, hotspots, keyboards, earbuds, those sorts of things, but also assistive technology that can help older adults feel confident. So if it's maybe their smart home technology, a Ring doorbell, an Alexa, different assistive technology devices. I'm thinking like screen readers or amplifiers so that they can, help listen to the radio or TV or read a newspaper, those sorts of things. So yes, they are a great program, and I can drop that information in the chat here too. I did not cover that. Like I said, I can be here all day. We can talk about all of our great programs, but yes, that is a great one. And I'll put that information in the chat as well, so you have that.
Perfect. Are there any other questions? All right, Nancy, did you have a poll that you wanted to?
Oh, you know what? Mike usually does that, and I didn't prepare one, but I actually could probably get one, rolled out here in about 30 seconds.
Okay.
If there's anything else that you guys need to cover.
Yeah. Any other questions? Anything else that anyone's thinking about? I saw some of the publicity for the, remind me, Liz, what it was called for the broader plan, not the state plan on aging, but the multi-sector, I think is what it was called. And It's exciting to, that's coming. I saw a lot of momentum about that.
It is really exciting. I think we're maybe the 8th state in the country that's launching this planning process. So yes, we're one of the leaders, and it is very exciting. And when you think about it, in state government, our downfall tends to be we're a little siloed. So this is really helping to break down silos, to think about things holistically, and to set us up for the future. So we are just really thrilled.
Great.
Kathleen asked, are all of these services available to disabled individuals as well? Great question. So one of our sister agencies, the Department of Human Services, they have specific programs, thinking the DOORS Home Services Program, for instance, that are really more targeted to adults with disabilities. That's not to say, though, that, if you're 60 and older, that you couldn't access services through our aging network. We tend to work well and try to coordinate as much as we can with our sister agencies, but the eligibility criteria typically tend to trend younger for the home services program. Once you hit the age of 60, you kind of advance into our programs, if you will. But I know DHS will be presenting next week or the week after, so Diane will be sharing some really great information about programs for adults and adults with disabilities.
Yeah, and just a reminder, that's in 2 weeks. It's on Thursday, August 29th is when we will hear from DHS. And then the following Thursday, September 5th is whenever we'll talk more with Sandy about the state plan on aging. And it looks like Nancy's put the poll up just to kind of get an idea of what, if this presentation increased your knowledge about services. So if you have a minute, if you could fill that out, it just helps us helps us have an idea if these are topics of what you already are very familiar with, or if there's information that we're able to share that's helpful.
And I'm just very grateful also that this, program has come on our platform and come to light with our audiences as well. And Laura, I don't know if you want to maybe give a little preview about the rest of the series and what folks can look forward to for the second and third option, or if you'd like me to cover that as well, I can do that.
Sure, I'm happy to. Again, Thursday, August 29th, we're going to hear from Diane Campbell, who is with the Illinois Department of Human Services, and she's going to talk about the Family Community Services Program. So that'll be noon on August 29th. And then on Thursday, September 5th, again, Sandy Pastor with the Illinois Department on Aging, one of Liz's colleagues, is going to talk about the state plan on aging. And again, that's going to be a little bit different. A lot of these webinars are more like today's, where we have a presenter kind of presenting, and then there's a chance for Q&A. That is going to be more of an interactive, and they're looking for feedback. And so it'll be a little bit different than what you're used to if you participate in these webinars in the past. But we definitely want you to attend, and if you have an interest, you might have good feedback to good information to provide, and that's what they're looking for. So this is a way for them to reach folks that are interested in this topic, and especially in rural areas as well. So please consider attending both of the next two webinars in the series.
Thank you,
All
Laura.
right. Yes.
And yep, I'll just mention that we have the registration link in the chat, and I can put it back in there. So, the information Laura just shared with you is on that link on that registration page, and you're very welcome and encouraged to share that with anyone else you think might be interested in attending. And of course, we'll get the recording up on that, and then they'll be able to catch up as well if they join at a later webinar. So I really thank you so much, Laura and Liz, and want to let you all know I hope to see you back here on August 29th.
Sounds good. Thank you, everyone.
Thank you so much. Take care.